Big today, more of you will be able to get the COVID-19 vaccine. The state will move to phase 1B of the rollout. So if you're a teacher, child care staff member, first responder, or you work in a jail or shelter, you can get the shot now.
Those of you 65 and older will also get the vaccine. Essential workers, teachers, and child care workers will be told by their employers when and where they can get it.
We have Lieutenant Governor Gilchrist joining us this morning. He chairs the State Commission on Vaccine Education and Safety. Good morning.
Good morning. Good to be here with you today.
Thanks for joining us. I know you've heard the criticism for the state not getting this vaccine out quickly enough. If the federal government has sent us more than 725,000 doses, as they say they have, then why have medical workers given fewer than 200,000 of those?
Well, first of all, we want to make sure that everyone knows that this expanded eligibility is part of our plan to make sure that we can get everyone vaccinated as quickly as possible. A plan to get up to 500,000 people vaccinated a day. And so we need to make sure that folks are signing up at michigan.gov/coronavirus, or that they are contacting their local health departments to make an appointment. The truth is we've still been getting less than what we've been promised from the federal government. And so we're working with them to try to rectify that situation. This has been a problem ever since the beginning. And we're hoping that in these closing days of this administration that they will stop withholding vaccines at the federal level and send more to the state so that we can get more to people, because people getting vaccinated is the key to getting our kids back in school, our economy back at full capacity, and all of us working towards a new set of normalcy.
Lieutenant Governor, does the state have a plan right now for how we're going to handle vaccinating the general public once we get to that phase of the plan?
So the plan is continuing ongoing, and we're planning, as long as we're continuing to get more vaccines, we will get more people vaccinated. And so this is the next step, is making sure that those who are eligible starting this morning are going to their local health departments and going to michigan.gov/coronavirus to get vaccinated. And as we ramp up that capacity, we will ramp up the outreach, we'll ramp up the planning. We're already working with pharmacy partners as part of the federal long-term care program, and we're going to continue to expand availability beyond that as we move through the phases of the process.
Lieutenant Governor, how many doses has Michigan received from the federal government?
So the number is about 720,000.
So you said that you're dealing with not getting enough, but we've only vaccinated fewer than 200,000 people in Michigan, correct?
There's been about 200,000 people vaccinated, correct.
So why is there such a big difference in how many vaccines we have versus how many we've given?
So we're continuing to move through that process at the local level. We've continued to build capacity with our local health departments as we roll out this long-term care program with our pharmacies that have now been ready to get started. That'll help us also get through those vaccines. This is about pipeline, and so we need to make sure that as we're moving through that we have more vaccines lined up, and that's the part that we're still waiting on and working out with the feds.
Okay, Lieutenant Governor Gilchrist, we want to thank you for taking some time to join us here in West Michigan this morning.
Thank you, everyone. Please be safe, and please sign up for an appointment to get vaccinated.
It's 6:50 right now.